Hello everyone, welcome to DHN CXO podcast, and today we have with us Mr. Mohammed Farouk, Chief Operating Officer at Rela Hospital, Chennai. Thank you so much, sir, for joining in. And first of all, congratulations on your new role and on the new journey. Thank you so much for being part of DHN CXO podcast.
Thank you, Aarti. Thank you so much for the opportunity.
Well, let me start with my first question. You're leading operations at one of the world's largest and most respected liver care hospitals. Could you share your journey into this role and what excites you most about shaping its future?
Well, Aarti, my journey, to be fair, it's been shaped by both opportunity and purpose. I didn't begin in hospital operations, but I've always been drawn to healthcare. Because it's one of the fields where uh, decisions that you take can impact lives directly. Can create a huge impact. See, over time, I've worked in multiple roles. Actually, initially, I was on a more of a research-based role. I've done my master's in biotechnology. I was working on cancer research, and then I moved into the hospital industry, where I was in the research role. And I tried to get into admin also, mostly as trying to help people who are there. But then I don't know if it's the business blood that's there. Family is into business, and once you taste it, it just came very naturally. And I started doing that, and I just enjoyed it. It just came very naturally to me. So I've worked across various aspects. I mean, in the healthcare management industry, I've been in business development, operations. At Rela Hospital, I first served as the vice president before stepping into the role of chief operating officer.
That sounds fantastic.
Thank you. Uh, what excites me here is the way this hospital is built up. Because we built up this hospital on Dr. Rela's vision. You know, uh, he of course trained here in India, went to the UK, built a name for himself, and he came back actually to India with a mission to say that I want to start off something in India which was world class. I mean, initially, of course, liver, but then he wanted a hospital to start off. He wanted it to be accessible and compassionate care, not just for a few, but for anybody who actually needed it. My role here is to operationalize that vision. I make sure that not only we deliver excellence, we are able to deliver that at scale. Now, uh, we've got a very strong institution. I mean, we see ourselves as custodians of knowledge and capability. What we've tried to do as our responsibility, we've ensured that we are able to help other institutes also. I mean, when you call yourself the best at something, I think it's moral responsibility for you to try and give something back to society. So we've even started off by helping the local government institutes set up their own transplant programs. You know, we've done that to private institutions as well. I mean, of course, the government hospitals, we don't charge anything because they don't charge patients internally. You know, we've been able to set up multiple self-sustainable programs in India, and I think that's what's been extremely exciting.
That's wonderful to know, sir. And I mean, Rela Hospital is a young hospital, but even within a short time span, it has become a global name in just a few years, performing over 1,400 transplants since 2018. From your vantage point as a chief operating officer now, what factors enabled this rapid rise to international recognition?
No, thank you for saying that first. Anthony. I mean, it's a good thing that you've read about it. I think that's a very good question, actually. Because it's just been a short while. So if you have to actually summarize that, I would say that I would base it on three different pillars: vision, system, and trust. So the vision, of course, would rely completely on Professor Rana. I mean, not only is he one of the foremost liver transplant surgeons in the world, really, but the ideologies that he brings to the table, that also brings along a lot of credibility for patients, not only in India, from across the world. And people see that. We call ourselves Rela Institute, but we also do a lot of training, teach people. And his vision is that. His vision is excellence in care, not only at our institute. We try and see if it can be spread across. So I think that vision is one of the things that puts us far ahead than most. The second is systems and processes. Now, when you're doing so many transplants that you're doing, and that too in a very short while, it does, of course, depend majorly on the medical teams that you have, but not just that. I think you need to develop a ecosystem around. So you need to have a fantastic critical care team, a donor program, a recipient program. Your infection control needs to be at par with the West or even better. Constant training, your nurses being trained, people to be trained, your coordinators to be trained. And there's a huge investment that goes into this, not only into infrastructure, but into training, mentoring, and bringing it across many other people to make this again. Finally, I'd say it's trust. Unfortunately, I have to say this, but sometimes when we, as people in this country, say numbers and volumes, really says 90% as if it's just something. Oh, hamara result to 90% hai. We at Rela take that as a very serious thing. So if you don't have something, you can't say it. But when we say it, you can go and Google it and it'll be there. I mean, our 1 year survival is 99.2%. That's our best 1 year survival. But when we said that, many people said, "Oh, I think that's very common," even though it's not even in the best rate. But I think trust comes automatically from the outcomes. Patients and families, they don't want to just look for the best technology. They also want to see what's been proven as best for results. How successful a program is. That will build confidence, over people, how your outcomes are. And people have to publish it. You have to be open about it. You need to be, you have to practice what you preach, and you have to be what you say that you are. Otherwise, people will find out, at least eventually, and not believe. So I think trust is very important in this field of work.
No, absolutely. In hospitals, we say that trust is a currency on which people believe. It isn't about how shiny the hospital is or how well and advanced the technologies is, until and unless it gives back care and quality care to the patients. I mean, that's where actually the real value lies in healthcare specifically. Now, Rela Hospital houses India's largest dedicated liver transplant ICU. How has digital technology shaped the way your teams manage such complex or high-risk cases?
I think that's a brilliant question. I'll tell you why. Because our ICU, I mean, you said India's largest. It's actually one of the world's largest liver ICU, dedicated livers. Yeah. But I'm really proud of it. I mean, not only is it the world's largest unit. I mean, let me bring up a bit of history. So the very idea that liver patients need a separate ICU was pioneered by a doctor called Professor Julia Wenden from King's College Hospital. And she was the one who came down and inaugurated our liver ICU. So she had worked on the protocols, that defined as to how critically ill patients, liver patients, should be cared for, And we wanted to carry out that vision because that was one of the niches that we were actually specializing in. When you're running the largest dedicated liver transplant ICU, you're dealing with some of the most complex cases, the most high risk, and these guys will need 24/7 monitoring, precision in decision making, flawless coordination across multiple specialties, not just liver, even though it's a liver ICU. These are areas where I think digital technology has transformed the way things are. I mean, in the last few years, I'd say, advanced monitoring, if you say, you can get real-time data, vital parameters, which allows early identification of complications, like sepsis, for example. You've got AI modules that can identify sepsis in patients before it can be detected in tests, and we use that. And it's a brilliant program because time is money. And those decisions that you can take much before, it makes such a big difference. That's one of the things. I would say that these predictive tools, advanced monitoring, even though you can predict how soon a patient will get deteriorated and critical, helps you deal with them much faster. All that said, I'd still say that technology alone does not save lives. I mean, you need to have fantastic medical and nursing teams to use it, And there are two things. One is you need to have a team that is happy to run with the change that is happening, which easier said than done. Sometimes is not what most hospitals are fortunate enough to experience or have. Because people are very resistant to change. I mean, they've been doing something for years. They're good at doing that, and they want to just keep doing that. But I think if people understand that this is a tool that's going to help them, then it can take you places. The other dimension is scale. Now, even during COVID times, we put up a tele-ICU, of course, not the liver ICU, but just the ICU itself. We put out a tele-ICU support for smaller hospitals across Tamil Nadu and in Australia, because they didn't have that kind of manpower. And all of this has been possible only with the digital tools that are there. So, in short, I mean, The tools haven't replaced the expertise. They've amplified it.
Uh, let's move on to the research part of it. I think you briefly touched upon it. Rela is pioneering not just in procedures, but also in research on cell therapy and next gen immunosuppressants. How are digital platforms supporting your translational research and innovation pipeline?
I'm going to break that up because I've got a bit of a liking towards or a soft corner towards research. I've started my career. I'm actually still doing research. So, at Rela, the one thing that we say in most of the meetings is transplants cannot be seen as something that's the end of the road. I mean, we are one of the highest volume centers in the world, but our focus has always been very futuristic. I think we need to try and reduce the need for transplants altogether. So 2 points I'll say before moving on. One is Dr. Rela is known for operating on a 5-day-old baby. But India's youngest, if you see, is a 42-day-old baby. Now, in terms of babies, that's a big difference, 5 days and 42 days old. Expertise to do transplants on a 5-day-old baby is so much more difficult than slightly larger babies. And that's easier to teach. So if you can actually avoid it even for a long time, you can save many more lives. Because I can't say everybody has to come here or this is the only expertise that you have to do. I think it has to be scalable. It has to be reproducible. That's the whole idea of it. So that being said, Dr. Rela, I'll quote him once. You know what he says? He says that I want to come out and be in a future where people call transplants as big, violent surgeries that people used to do. They would open up people and, cut out their livers and put a new liver inside. Because the vision should always be towards regenerative medicine, where transplants can be obsolete and not required at all. That said, we do a lot of research on liver regeneration and cell therapy, and hopefully we'll see something happening there. In terms of immunosuppression, I think that is one of the core areas that we look into. I mean, Dr. Rela has pioneered something called auxiliary liver transplants, where part of the native liver is retained. And in these patients, mainly patients with acute liver failure, where you do this procedure, even though it's a bit more complex, after some time, you don't need to go or need liver immunosuppression at all. So that just changes lives for so many people. I would also try to say that my PhD, I'm trying to work on cancer research. And we've actually found out a few genetic markers which can help us diagnose cancer earlier than you can see it on the test. So we've been able to patent these markers. And AI has actually helped us find this. So AI has been a game changer because we've been working on this for the last, I can't say 10 years because I've not put that kind of time inside saying every day I'm doing this. But, over 10 years, I've spent a lot of time on it. But in the last 2 years, it's just tremendously changed things. We've been able to isolate the exact genetic code. We've patented it, and fingers crossed it works like a dream. We're excited about it.
That's actually exciting. And since you mentioned artificial intelligence, my next question will be about AI. Across, say, last year, 2024, everybody has been talking about artificial intelligence and its impact in healthcare. And I believe Rela Hospital has been early adopter of AI technology. You have an AI-powered digital pathology now integrated into your workflows. How have you seen this change the speed, the accuracy, and the confidence in diagnosing liver cancers?
I think it's made a huge difference. I think the move towards AI, I might be more biased, towards digitizing hospitals, but I think it's helped so much more in terms of scalability, to increase efficiency, everything, our pathology, we've got a fantastic pathology department. It's a huge department, and we've got e-pathology. So we scan all our slides. They're completely digitized. And we've been working with multiple collaborators from across the globe to actually find predictive AI to diagnose diseases which might be actually missed by people, so that it can just be as a tool that everybody can use, And it has actually changed the way things work. Now, some of these models are already in use. Even we use it here. It speeds up reporting time. It reduces backlogs. And it can pick up patterns that any normal human being will miss, We also use it in radiology. I know you mentioned pathology, but radiology also has been quite fascinating because at least it can red flag onto scans that have to be seen first. We know what to prioritize. So just with AI, it reduces the load for the doctors. It sharpens accuracy. and it can help them prioritize the way they want to do.
You also have robotic assisted surgery and IoT connected beds. That sounds futuristic, and they're already in your hospital. Could you walk us through how these technologies are directly improving patient care and outcomes today?
Even though when you say that, it sounds like a bit futuristic, isn't it? But they are already here. We're already doing them here at a hospital. We've got a fantastic robotic department. We've got 2 Da Vinci robots here. And we are one of the largest centers that does all donor hepatectomies for transplant patients robotically. In fact, we've actually developed a protocol where we've done both the youngest child and an auxiliary transplant also completely robotically, even for the patient, not just the donors. And that's not been done anywhere in the world. So 2 things. I'm excited that India is able to put something on the field there to say that we're here and we are on the map. And it's good that people are turning towards India to say, "Oh, that's a fantastic job done." The second thing is that fantastic results can be delivered here. And I think these are landmark moments really, because everybody else from across the world is extremely excited about it. I love robotic surgeries because even though they seem extremely expensive today, consider in the future, they come down. Consider that the large volume, large need, government subsidies and whatsoever. And they are there everywhere. You can have a doctor sitting in Chennai, operating in Chennai in the morning, in Maldives in the evening, and in some remote village in close to Karaikudi in the night. So you'll have one of the best doctors accessible to people anywhere across the world. And that's just one example. So you can have any doctor anywhere bringing this up. So I'm really excited about robotic surgery, and I think that is going to be the future. You also mentioned the IoTs. IoTs are phenomenal because most hospitals, even to date, not only hospitals, I think that when India's seen a good growth in startups that have come down with AI, with digital tools and everything, and some of them outsource this IoT side of things. So they've got these ICU beds and donor beds that are connected. But we've got some fantastic devices. You've got ingestible devices. You've got implants that are IoT monitored. You've got home care tools that can monitor your patients when they're back home. You've also got environmental that we use very commonly here at Rela. So I think this is going to redefine the world, actually, how things are. And we're already there. We already stepped into it.
There has been a lot of talk about patient experience as well nowadays, and patient journeys in liver care are long and deeply emotional. How are digital touchpoints enhancing trust, comfort, and outcomes for the patients and their families? You might be, watching these families day in and day out. What has been it looking like from your perspective?
Aarti, I think this is a topic that's very close to my heart. Most of the conferences I speak about patient experience. I will touch upon the digital point, but I'm just going to take an extra minute here. I hope you don't mind. So, I think hospital industry, when you call about and think about the healthcare industry, what most of the people talk about is, it's a service industry. Correct. But I think we've crossed that phase now. I think we've moved on to the experience industry. It's like Disney or you getting a party at McDonald's. They don't charge you for the cake. They charge you for the experience. Cake is free. So I think experience is very important. That changes perspective of how people are. I believe there are multiple things that we can do. And I've been very, very, it's been a subject very close to my heart. Over years, it's always been very difficult to train people because when you try to train people to give somebody a good experience, you can tell them that, you have to go there, you have to ask them how they're doing. You have to tell them what you're going to do. I'm going to draw some blood, or I'm going to take your sample and ask them if they're okay with that. And they would have done all these steps, A, B, C. But after that, there'll be an awkward silence, really. And when they're actually dealing with the patients, they might not have a great experience any which way, even though they've done everything by the book. So it's very difficult to actually measure, which is why it's very close to my heart. And I think that human touch there can make a huge difference. The way things are communicated, the way things are said. There's a long queue. But if the patients have been informed, that there is going to be a delay, your doctor's trying to save somebody, and there's an emergency case, we are happy to wait. It's about not being able to have that kind of communication. And I think in the last 2 years, digitization of most of the processes has made a big change for us. We've automated communication. We've used AI-based queue managing softwares across, and they predict time and they message them and say that, look, right now the wait time is so much. Considering the way things are going, you've got such a big buffer of time. Let us know what you want to do, or go there and get your free coffee. And if you can have somebody do that, but if they miss it, that's one patient who's unhappy. So we completely automate that, which is good. We've got voice-based automation in the rooms where you can, like it's an Alexa technically speaking, but you don't say Alexa, you say, hey, Team Rela. And you ask them for your bill, or you order for an orange juice, and it's ordered. You cut the person, you have to call in, make your order, and all of that. And even though they know that they are being treated well, that is something that they remember. They go back and they talk about it. One thing that we've done recently, it's still in a trial mode here, is that, the credit card that we use. I've been saying this in multiple talks. I think it's just going to be that. I'm sure anybody who's listening to me is going to say, I think this is the only example he gives. But I love that. And I want people to implement it. So there's a lot of issues with patient compliance. People come in, until you actually involve them in their own care, it's a problem. They're generally not compliant. So what we want to do is put something like those credit card points that you get. Swipe your card, you get points, and then using those points, you can get something. And you're inclined to use that card at multiple places. Sometimes even say that, oh, you know what, I'm going to swipe my card, so just so that I can get those points there. We don't want you to spend more money in the hospital. Hear me out, but what we want to do is, if you are compliant, we give you back some of your money that we earn from you. The doctor said, get more mobile. We say, come down in 2 weeks. You walk 10,000 steps every day. Here's 500 rupees back for you. And you don't have to spend it in the hospital. You can get an Amazon voucher, whatever. You bring down your HbA1c. You reduce your weight. You take all your tablets on time. We'll give you back some of your money. So it's not only about trying to run a profitable business. I think it's also important that you make people get involved into things. And actually impacted on way people experience the hospital. The trust is also good. And then it's the pilot is working fantastic. I'll let you know how things pan out for us.
Absolutely. And I think when you speak about how digital technologies are actually become more successful, or the outcome for the patients become more successful when patients are involved in their journey, we also have to understand that these are the patients who exist in an economy which is an experience economy now. They are the same patients which are using Zomato, they're using Swiggy, they're using food delivery apps where everything is coming to them in seconds and everything is measured on the basis of their experience. So even the healthcare has to provide them the same experience.
Zepto is giving us a tough time. People are expecting things in 10 minutes. We are trying to get there. Not there yet, but yeah, let's go.
Well, that's a topic for another conversation, because can we deliver healthcare in 10 minutes? That's definitely futuristic and ambitious, but we also have to sort of look at the feasibility of that. Let's move on to the next question. And you already mentioned about the pediatric liver transplant that you have done at Rela Hospital, and it's one of the most remarkable achievements at Rela. What role does digital innovation play in ensuring the safety, the precision, and post-operative monitoring for these youngest of the patients?
So see, digitization overall has helped us. I'd say it helped us in adults and pediatrics. But when you talk about just the pediatric transplants, we are one of the highest volume pediatric transplant centers in the world. The numbers are very big. China does more than us, nobody else. China's got only one center. So given that we are a high-end center and we've got very young children who come to us sometimes, what happens is digitization for that has been very useful, because when you talk about 3D reconstruction of the liver, of the arteries, or how it's going to be, how you plan your surgery, that has actually helped us, because every millimeter, every gram of extra liver helps us take a decision sometimes. We are able to map anatomy today in a way which was not possible to even imagine 20 years ago, and it made life so simple. You know where to cut, where to go, and what to do. Also, when you look at digitization, it's not only the tools that we're using as softwares, really. It's also into various equipments that we've started using. Like, for example, robotics, when you're trying to use a robot. If somebody's got a bit of a shiver in their hand, it will cancel it out. anesthesia machines, they are all AI driven right now to understand as to what dosage has to be changed, predicted over time, and it's given automatically like that. It's like a computer driving, flying a plane. When you look at it, when you sit down, it's a non-hospital example, but when you're sitting down on a plane and you've got your glass of water, whatever, the juice, you'll see that it's straight, even when the plane is a bit tilted. And that's because it's been stabilized by the computers, which is not possible by humans to do. It's so precise. Similarly, you can get that done today here, and everybody has to work in tandem. And all of this has made it so much more easier for you to do. Your ICU monitoring, post-operative phase, they act as such a safety net. Really. Your remote follow-ups in the ward, you can track your recoveries. For people who leave Chennai, post-monitoring, international patients, all of that. And there's so much of patient engagement that can also happen with it. I think it's changed the way in which care is being.
Interesting. Let me go back to the point that you mentioned that the clinician team and the staff in the hospital also has to move at the speed of technology that you are implementing in your hospital. Now, what happens in a lot of hospitals is the technicians or the IT team or the management implements a technology. The doctors are and the clinical team is sort of there's a gap in which they understand this technology or can use this technology, and the change management becomes a problem. Now, how do you at Rela, because I believe you have a very successful implementation of technology and clinicians are using that, how do you ensure that you also use technology without overwhelming the clinicians?
So when you are actually talking about this from a leadership role, I would say that it's important to include people to make them understand as to why you're bringing something in. Because look, it's either why or how. These are the questions that you're actually trying to answer by bringing in technology. You're either trying to get more efficient or you're trying to save time. Again, efficiency or money or betterment for the patient or something. So the point is, it's important to have people come on and include them as part of discussions. I mean, you don't have to have them in all the discussions, but at least once you've narrowed down, it's a good thing to bring them in, find out what they would want. The second thing is, when you're implementing it, create champions across. It's very difficult to make people want to take change. And it's important that the leadership also gets involved. If you want doctors to start using EMRs and everything, I think you should also sit down and start doing it yourself. And you should have a support system to slowly make them change to go into that system, Because doctors, I'm sure, would feel that my time is more useful sitting in front of a patient rather than a screen. And we agree. So it should always be that the screen should only help you spend more time in front of the patient and not you spending more time in front of the screen. So, that's the idea of it. So that's very important. And then training. I would say because that is something that will stop people from using systems. Yeah, I think these would be the three main things that would help you actually ensure that you're implementing proper systems.
So, looking forward, what does the next frontier of digital transformation in liver and multi-organ care look like at Rela hospitals? And where do you see the biggest opportunities for impact in the next 5 years?
I think it's going to change the world. AI is going to just change the world. And not just AI, digitization itself. Hospitals have been late into digitization compared to the other industries. But post-COVID, I think we've been able to pick up faster than any other industry. So that's a good way to catch up, but we're still eons backward compared to most of the industries. And that will change. I think the next 5 years will change huge. I'd say precision and prediction. This is one thing that AI is just going to revolutionize. I mean, you're looking at genomics, the advances that we are making with AI and digital pathology and radiology. We are moving closer to predicting diseases before it can be diagnosed in the usual ways that it has been diagnosed over years. We are into that research, and we're actually seeing that happen even right now. And that change is coming up. The second is, like I mentioned to you, access, and that too without borders. And all these tele ICUs, people able to run that, people able to sit here, diagnose for people elsewhere. That accessibility is just going to disappear. When you move on to digital platforms, when you've got robotic surgeries, you've got tele-ICUs, you've got remote monitoring. All of this is going to change the way in which healthcare was being seen, at least in automated communication. Personalized AI-based reports. Just to give you an example, when patients come in and today, when they do a master health check, initially you'd get a bunch of reports that you'd see, and you'd just try to see which are the parameters which are high and which are the parameters which are low, because it doesn't make sense to anybody. But you've got an AI reporting now almost everywhere, at least many of the big places, which will tell you what sense that report actually makes. Give you some insights about what you should do. Should you make some lifestyle changes? Do you need medication? Do you need to see a doctor? What kind of a doctor you need to see? When we do it for corporates and companies and groups, it will give you insight on the groups. High-risk population, they can maybe even insure them for a higher value. They can put them in areas with less stress. So the ways in which it can be used is fascinating and extremely exciting at times to come. So I'm absolutely excited about the way things are going.
One parting thought before I let you go. What would be your message to your peers?
I think for me, leadership in healthcare means more than running operations. It's about building ecosystems for care that is scalable, sustainable, and most importantly, something that will give hope to people. That's kind of the legacy that leaders shouldn't be thought of running operations. It should be about how one can build ecosystems, how care can be provided at a scale in a sustainable way, and in a way that people get hope out of it. And I think leaders should have that kind of a thought process.
Well, thank you so much. Thank you so much, sir, for this conversation. I believe a lot of your peers would have good takeaways from this conversation, and
I hope so.
wish you very luck and see you around. Thank you.
Thank you, Adi. Thank you so much for your time. Thank you.